The promotion of physical activity among youth has become a major public health concern because childhood obesity continues to rise worldwide. For many years, youth fitness programs focus mainly on aerobic activities including jogging and swimming. However, recent studies and research have built a strong argument that resistance training can be a safe, effective, and worthwhile method of nurturing the growth of adolescents, providing correct guidelines are followed. Although resistance training must have its limits for young people, the exercise provides participants with an opportunity for variety and the ability to experience new skills. Various benefits can be associated with resistance training throughout puberty. Some include muscle strength gain and muscle hypertrophy, motor skill performance improvements, prevention of obesity, higher self-esteem. Some others are listed there. Various myths can also be associated with resistance training and the influence on growth on puberty. One is fiction. Strength training is ineffective at younger ages due to the prepubescent individuals having insufficient hormones to produce strength. Fact is, various studies have demonstrated that children and adolescents can improve strength with resistance training within less than 3 weeks. Feigenbaum and Kramer 2009 can support this. Fiction. Weight training will damage epiphyseal plates and stunt growth. Fact. Bone density actually increases, and Coburn and Malik 2011 can support this. So studies have shown us that moderate physical activity levels decrease in a linear fashion throughout schooling years in regards to hours per week. Also, vigorous activity decreases dramatically at the ages of 11 to 12. Gender differences can also be seen. At grades 4 to 6, females are 50% less likely to participate in vigorous physical activity. Resistance training provides a variety of activity and is suitable for shorter attention spans. Therefore, it has the possibility of keeping adolescents active. Various factors influence growth and strength while participating in resistance training programs. So hormone levels. Growth hormone and testosterone peak throughout puberty. Therefore, this emphasizes an important time to encourage greater growth throughout free weight training. Gender. Males have testosterone to increase the amount of growth. And with muscle length, it can result in longer levers to lift weights, which in turn increases the possible amount of weight that can be lifted, and this results in greater levels of muscle hypertrophy. One of the great myths is that weight training will stunt your growth and increase the potential for injury, especially at the epiphyseal growth plates. Of course, the volume of weights loaded needs to be adapted to the individual, but contemporary research suggests resistance training has a positive effect on growth. A compelling body of scientific evidence indicates that children and adolescents can significantly increase their strength above and beyond growth and maturation, providing that resistance training program is of sufficient intensity, volume, and duration. This can be seen in Kramer and Feigenbaum. Collectively, these findings, along with clinical observations and evidence-based reviews, indicate that well-designed resistance training programs can enhance the muscular strength of children and adolescents beyond that which is normally due to growth and development. It is during puberty that genital development is readily observed, which corresponds to increased levels of testicular testosterone secretion in males. The hormonal influence is most often associated with considerable increases in muscle tissue as reflected by fat-free mass. The resulting progression of fat-free mass closely reflects the testosterone increases observed, which can be seen in the graph shown. Other hormone and growth factors intimately involved with growth and development, such as growth hormone and insulin-like growth factors, might be hypothesized to be contemporary factors that augment the muscular development in females. So recently, Blimke 1989 and Ramsey 1990 studied the overloading of the elbow flexor and knee extension muscles using isotonic resistance training. After 10 weeks of training, significant improvements in 1 repetition max in bench press, arm curl, and elbow flexion strength had occurred. Following another 10 weeks of training, various exercises including the bench press had seen a 35% increase in 1 repetition max. The result from this study and others provide us with convincing evidence that if the adolescent is mentally able and the correct intensity and frequency is applied, strength is increased over a period of time throughout the resistance training. Blimke 1989 and Ramsey 1990, as stated before, found that there had been no completely obvious evidence of increased muscle hypertrophy for prepubescent participants. Seeing as though strength was increased, the results are surprising. From these findings, they suggest that resistance training during pre-adolescence does not cause muscle hypertrophy. It can be considered that strength gains throughout the training phase are dependent on changes in muscle size during an individual's growth and development. Current research suggests that increase in muscular strength correlates with increased muscle hypertrophy. However, Fagermore 2009 states the mechanisms appear to differ according to the stage of development and are tissue dependent. From this statement, it can be understood that although hypertrophy is not evident in prepubescent training, adolescents may achieve additional gains in lean body mass and cross-sectional area. Therefore, the aim of resistance training for children should be muscle strength and control, whereas when training adolescents, a long-term approach should be considered for training-induced adaptations throughout development, including strength and muscle hypertrophy. The reason for muscle hypertrophy in puberty opposed to prepubescent years is associated with the increase of testosterone in males and the prevalence of neuromuscular development of muscle tissue in both genders. Both graphs illustrated here highlight the testosterone and sexual maturity increase in adolescents. With any training program, individualization, proper progression, and variation are basic concepts that should be observed. The individual's ability to tolerate and recover from exercise session is also important. It's important for the youth to begin at a level suitable to their physical capabilities. If the volume and intensity of the training exceeds individuals' capabilities, the rest periods are too short, exercise may decrease enjoyment and increase the risk of injury. Guidelines include qualified individuals supervising the training, safe training environment, preceded by a dynamic warm-up resistance training should be. Includes all exercises from upper body, lower body, and core. Resistance training is to be increased gradually. To participate in 2 to 3 times a week in non-consecutive days. You must vary the training program. If the correct procedures are prescribed, resistance training can be a safe, effective, and enjoyable method of training that influences the growth positively throughout puberty.